It's always amazing to be the last person standing between you and a bar and about another hour of panel discussion. So thank you so much for the time. I'm going to bring you up to date on developments in our technology. Our company is a commercialization stage company, and I'm going to make a confession up here as a lapsed Catholic. I'm accustomed to this. And I'm going to talk to you about how medical devices, and all of us in this room need to think about how we work with physicians, because we don't always do it well, and it's been a learning process for us. Let me start at the beginning. AMD is a big problem in the country. 115 million people over the age of 50. Unfortunately, I'm one of them. 12 million people have AMD. 3 million have been diagnosed. We have 100 people in this room over the age of 50. It means that 10 of us will have AMD, and one or two of us will lose our sight. And you say, really? This is bigger than glaucoma and DR combined. And when you look at it, how are we doing? On first visit to a retina specialist, 22% of the outcomes are great in the first eye. Unfortunately, 78% are not. In point of fact, half of people are actually legally blind in that eye. It's going to happen to 1 or 2 people in this room. So we decided that when you're thinking about something where a disease where 15% of patients will suffer vision loss, severe vision loss, and we spend billions to enforce this standard of care, would it be a great idea to find it earlier? So our company built the AdaptDX. And what we do is we measure dark adaptation, which is a biomarker for AMD. And you've probably seen this. I presented it here last year. We're in our 3rd or 4th year now of launching this product. We're a commercialization stage company, as I mentioned earlier. And we can find AMD 3 years before you can find it on structural assessment. It's 90% sensitive, 90% specific. AREDs have been proven to demonstrate that we can defer progression of the disease. Patients are in the physician's practice. They just simply haven't been diagnosed. We've got a CPT code. It drives exams and OCTs and other things. And finally, it drives a lot of revenue. A typical 4,500 patient optometry practice can generate about $200,000 a year. But like the panel talked to us earlier today in the context of dry eye, it's just not all about technology. Because our beloved box, the AdaptDX, poses a lot of challenges. Scalability. It takes 6.5 minutes to get to the cut point for AMD, no AMD, in the dark with a tech. Workflow issues, staff training issues, patient comfort. Older people holding their chin on a chin rest for 6.5 minutes is just too long. And as a result, it's a nice to have instead of a need to have. And we realized it was only a part of a larger solution. So the lesson here that I want to share with you as a commercialization stage company, I know many of you are raising capital for earlier stage companies, is we sometimes forget the challenges that eye care professionals face on a day-to-day basis. This is a big problem because we tend to, as an industry, be technology-centric, but we don't think about what it's going to take for it to happen. Running a practice is hard. Adding more medical is difficult. Changing behavior is time-consuming. How can we do more with less? In managing a chronic disease, it's not something all ECPs are accustomed to, particularly in optometry. How do you preserve precious time with patients? How do you manage complexity? Another test? Oh my. See what this said? They're calling it their test. But there's a need to diversify, because margins are being impacted on lenses and on frames. So we said, hey, we raised money on a model that said we started off as a single product, single disease, capital equipment diagnostics company. There's about 3 or 4 words in there that are a death sentence for anybody raising venture capital. I used to be a VC, trust me, I know. And we built it, but we realized really quickly that we need to be repositioned. How do you become a recurring revenue multi-technology company? How do you become ECP-centric? And ultimately, how do you think about applying automation and wearables and disease management in optometry and ophthalmology in a way that cares for both the eye care professional and her patient? So we went crazy and we did something that we should do more often. We talked to our customers. I know you've all heard this before, but you better understand how they view the world, because when we put the patient at the center of the practice and made sure we talked to the optometrist and the staff, we learned a ton. They wanted something smaller, simpler, faster, more integrated, and much, much cooler. Our current box weighs 45 pounds, 720 ounces. And the challenge we posed to our R&D team was, well, I have 43 seconds, we're gonna play this real fast. This is the new generation of technology. Artificial intelligence built in.
My name is Thea, and I'm the new onboard technician for the Adapt DX Pro. From what I've heard, the job of the technician is absolutely vital to ensuring accurate test results that will help doctors diagnose AMD with confidence. That's why the Maculogix team came up with me, Thea. I've been programmed to provide patients with a consistent and reliable test experience. I just need my human counterpart to tell me which eye to test and which protocol to perform, and then I take it from there. I start by providing each patient with an overview of the testing procedure. Then I guide them through the actual test and monitor their progress from start to finish. I can tell if they are having trouble and will ask them to stay focused, blink, or open their eyes as needed. I also love positive reinforcement, so I will let each patient know when they are doing a good job. I'm very excited to help doctors accurately diagnose and manage AMD with the Adapt DX Pro.
So first there was Siri or Alexa, I'm not sure which, and now there's Thea. We're bringing automation, process automation to practices because there's no way we can cope with the scale and change of technology in these practices without help. How do we preserve the physician-patient relationship, restore time to the physician and their staff to do the high-touch things? And it takes more than simply miniaturizing 45 pounds into 1 pound. It requires a fusion of technologies, and that fusion of technologies encompasses, yes, miniaturization, but it also requires a cloud-based, voice-activated system. And I'm way over time here, but I want to add it's not as simple as that. We've also had to build in behavioral systems to help practices adopt new technology. For those of you who are raising capital, I cannot tell you how important it is from a practical point of view to figure out how it fits into the practice and how you make it work. We learned this the hard way. And finally, we've also changed the entire way we sell because we now sell everything as a diagnostic, as a service. It's no longer a capital equipment play. So it's affordable and much more effective. Thank you very much, and you should all be tested, by the way, because 2 of you have got trouble coming up. Thank you.